Hello. Just kind of waiting to get up around 100. Okay. We'll go ahead and get started. I don't have just too much. I see people saying hi in the comments. Hello. Good afternoon. I don't have just too much today. We haven't had any new cases reported today, so that's good news. But so we'll still be at 44 unless we get something between now and 4 o'clock. But at 44 with 8 active cases. And we expect a couple of those to be removed from isolation probably tomorrow based on our investigation. I know there's been a lot of questions about, community transmission. I've had a lot of questions about, where we're at. Of course, over the last couple of weeks, if you look at the numbers, we have had a few cases be reported that have no known contact. So that means that it probably came from somewhere in the community. And again, we've talked about that, the virus is out there. We need to continue treating it as that it is out there and it's not going away. So we need to continue to take those precautions that, we've talked about for weeks and weeks and weeks. But it's important to know that, we look at a lot more data than just the total count or just, new cases, that type of thing. So we look at a couple of different things, active cases certainly and what the trajectory is over time. And then 3-day rolling average is something we've been looking at as well. And so that really means the 3 days prior. So if I'm looking at today's 3-day rolling average, I'm looking at cases reported today, cases reported yesterday, and the day before that, and dividing that by 3. And so when we look at that data, that helps us know what the trajectory is and where we're at. And so right now we still feel good. We're able to manage cases. We're able to jump on cases and isolate and quarantine very quickly. Healthcare capacity is good. Testing is increasing, and yes, there's going to be testing in a variety of different congregate settings in the county. And we know that, that's taken place at the mental health center already. And then the state's looking to, test the prisons. If they haven't already, we haven't heard from the state on that. And then they're also looking to do some serial testing at nursing homes just as a surveillance method, not because we have not had any cases associated with nursing homes at this time. So that's, again, great news. But again, we need to be vigilant and we need to treat it as though the virus is out there, because it is, and we need to expect more cases. We don't expect that we'll never have another case. We know we're going to continue getting cases over time. And so we just need to expect that and continue to take those precautions. One thing that I did want to mention that we did update in our guidance. Now you know that we're still in phase 1 of the governor's plan. That is extended until June 15th. And we haven't gotten any guidance about a phase 2, if there is a phase 2, that type of thing. But we have guidance up on our website that's kind of above and beyond some of that. That's not mandates. It's just guidance to help people decide what is right for them. We had a 10-person gathering limit that we had set kind of early in May. And again, that's not a mandate. That is guidance based on the national guidelines from the White House, and we've updated that to 50. But the important thing is just like what you see in the state order, the biggest thing is social distancing. So we really recommend avoiding gatherings that social distancing is not able to be maintained, and that is in the state order for social distancing. I just wanted to hit a little bit on our services. So as our community opens back up, the services here are also opening back up. And so our nursing services are available by appointment. So we never stopped doing immunizations. We certainly had a large increase or a large decrease in the amount of people coming in just based on stay at home and wanting to stay out of the public. But we are open for all nursing services, but by appointment only. Typically, we've taken walk-ins in the past, and that's not to say we won't take a walk-in, but the big thing is we want to make sure that, we have a small facility. We want to make sure that people can social distance when they're in our waiting rooms, that type of thing. So it's really important to get kiddos in for immunizations. Back to school here is very, very busy, and we don't want anyone to have delays when back to school time comes. And clinics are going to be different this year because they will be by appointment only. And so, when we have hundreds of people through the door, that's just not going to be able to be possible at this time unless something changes drastically. But we're planning some clinics in the schools probably after the start of school. But again, right now is the time to get in and get those taken care of, and then you're done. So I think that's all of the kind of things I wanted to hit on for me, and then I'll try to scroll back through here. I know that I don't see just a ton of questions coming through. Wondering about all the tests done at the mental health center and whether they will be counted in St. Francis County or the person's home county. Yeah, that's a good question. So positives are counted in the county that the person resides. So if I, live in St. Francis County and I work in Jefferson County and I test positive, I'm still counted for St. Francis County. Same with even the negatives, because we are getting some negatives reported to us. It only comes to us if that person lives in our county. So it has to be a resident of the county. So when you look at our numbers, those are people that live here. They might not necessarily work here, but they live here. And then, when we're doing our investigation, we coordinate with other health departments and contact employers if needed. Just really depends on what that investigation brings out, but making sure that that county health department that a person resides in knows the situation in their county. Where can you get tested in this area? Actually, on our website, we have a list of the doctor's offices that are testing. So you can take a look at that. If you go to COVID-19 and hit testing, you can see the list of testing sites and then some numbers to call for their offices to be tested if you're interested in being tested. Just trying to scroll through here. I don't see a ton coming through. Someone said they wouldn't go back to school without a mask. Is that true? I think what you're asking is that, I think what this question means is, will schools be allowed to be open, and will basically masks be mandated at school? At this time, I do not think they will. CDC has some very lengthy guidance out on returning to school, that type of thing. And I think a lot of it's going to depend too on what community transmission looks like at that time. And it's really hard to, look in a crystal ball and figure out what's going to be happening in August and September. But we know the virus is going to continue to circulate. So it's something we have to consider. And, I think masks are certainly going to be allowed at school, but, some of this is going to be individual school decisions about how they want to proceed with, their capacity and that type of thing in the school. I will say, CDC guidance is great. It is gold standard. It is scientific evidence, but the guidance is very stringent. And to be able to social distance in a school, I think if we're speaking realistically, it's tough. It's a really tough thing. So we're gonna have to be really realistic about what expectations are when schools come back, and doing the best to social distance and do screenings and really sticking to exclusion criteria. And what that really means is, when a kid's sick, they don't need to be at school. And we know that sometimes that can be lax, and that's going to have to be pretty strict when school comes back into session. So a lot of work being done on that. I've talked to a lot of the schools over the past couple of weeks and provided them guidance from CDC. And I think you'll probably see some variance between schools. But again, if you have questions about what the school's plan is, I would suggest to follow up with them. And again, you may even see some blended learning where there's kind of this option for some virtual, some in classroom. And again, follow up with your school. But, as of right now, if there's a case you're looking at quarantines for 14 days for people who are exposed. And so you can imagine if you're having to exclude that many people in a school, and are they going to close for cleaning? So there's lots of nuances there, and certainly children are a vector for disease. Just based on hygienic practices and their close proximity in schools. I mean, if you look at our flu data, and again, I don't want to put flu and COVID in the same bucket here, but when you look at flu data, a lot of those cases are in the 5 to 14 year old range. And, flu is not investigated in the way that COVID-19 is. Flu is investigated by numbers, and we investigate deaths. And so, that 5 to 14 range, we always see lots of cases for flu. And so, I think it would be unreasonable to say that we'll never see a case of COVID-19 in a school. I'm sure that we will. And the schools are working on planning for that right now. Wanting to know if all of the previously contaminated tests have been recalled and if the new ones are free. I'm not sure what the question is asking exactly. We don't do testing here, so we haven't had much dealings with that. I'll have to do some research into that. I'm not sure on that one. Any update on a vaccine? I've read some different things. I've read some different things from, credible resources. We are planning, and we've done mass vaccination clinics in the past. We're planning for the possibility of a vaccine. And then, what I've read is that the people who will be prioritized are, of course, elderly folks, people who are at highest risk in those risk categories, having those disease processes that make it higher risk, and healthcare providers. What I've read is the earliest to expect would be December 2020, and that's the absolute earliest. So, that's still a lot of work to be done on the vaccine front, but that's something to, again, keep in mind. Again, not putting flu and COVID-19 in the same bucket, but recognizing that we're going to continue to have cases, especially without a vaccine. So again, we just need to expect that. But we're working on, again, plans for mass vaccination if that needs to happen. And we've carried that out in the past and are used to that because we already do that. So that's the good news, at least on our front. And then when you look at nursing homes, hospitals, doctors' offices, they usually become their own, what we call pods or point of distribution. So it's not a place where we typically would go and just vaccinate all of their folks, because they have people there that can vaccinate. They have the place for storage, that type of thing. And so that helps us out in capacity too. So when we think about mass vax clinics, we're thinking about, general population, that type of a thing. Trying to scroll here, looking at my time. Will the clients, patients, prisoners at the different facilities be counted as St. Francis County residents? I've talked about this on a couple of lives. Typically, the prison population are counted for St. Francis County, typically. Now, Bonne Terre has the routing facility, and so it kind of depends on if someone's in that facility, how long they've been there, and where did they come from, because oftentimes if they're going to be rerouted somewhere else, or if they just got there and they acquired it in another county and we're pretty sure that that's where it came from, it might be counted there. But usually the prisons are counted as St. Francis County data. So, but again, there's some caveats to that a little bit, but for the most part, yes. I already answered that. When do we get vaccine shots for COVID-19 virus? We don't have a vaccine yet. And so, when that happens, there'll be lots of information that comes on that, but we do not have a vaccine yet. But, regular immunizations that, we always provide here at the health center, those things are still really important to stay up to date on, especially for kiddos. So, Alrighty, it looks like that's the end of the questions. I just want to remind everybody that I'm doing lives every 2 weeks. The audience is dwindling, but that doesn't mean that you can't answer questions. You don't have to wait until live days to ask questions. Call us. We also are going to be doing some like frequently asked question Fridays. We're lucky enough to have an intern from a university in Missouri, and so she's going to be working on some of those things. So you don't have to wait until lives to ask questions. Please call us. Again, we can't talk about specific cases, but we're happy to talk to you about how reporting works, how investigation works. And you know, just as a reminder, you know, we investigate disease all the time. And so this COVID-19 is new and we continue to learn more about it. But contact tracing and disease investigation is normal actually in our everyday life in the health department anyway, as we investigate disease that is reported daily. So the next time I will be on, I'm looking at my calendar here, June 18th is the next time I will be on. But again, holler at us, reach out to us if you have any questions. Thank you for everything that you're doing in the community. Please remain vigilant, hand washing, staying home when you're sick, wearing a mask where social distancing is not easy. You know, those things are all good practices to help us prevent infections, especially as we learn more about asymptomatic cases spreading the disease. So thank you so much for being on. I see somebody asking, how can someone get tested? If you think you've been exposed or you think that you have symptoms, you're sick, you need to reach out to your healthcare provider and they can give you some advice. And we have a list of those on our website under COVID-19. So thank you so much. Bye.